A man with gray hair and his beard jogs outside. Logo, Cardiost. Text, quality of life, beyond a healthy heart. Nicolas Anzellini appears in the lower right corner of the screen speaking to us from his office. New slide. Text, what is heart failure, HF? 1. Ventricular remodeling. Heart cannot keep up with its job. 2. Traffic jam of blood and lungs. 3. Organs don't receive what they need to function properly. A diagram shows a heart and lungs. An illustration shows an elderly couple, the wincing man leaning on the woman and clutching his chest, which glows red under his hand. The woman looks up at him in fear.
Good afternoon, everyone. My name is Nicolas Anzellini. I am the CEO and co-founder of Cardiost, a medical device working on a breakthrough mechanical circulatory support device, also known as a heart assist pump, for practical purposes to treat late-stage heart failure patients like Mr. Funk, whose heart cannot keep up with his job, creating a traffic jam of blood in his lungs and depriving his organs of what they need to function properly. It is also impacting Mrs. Funk, his caregiver.
Text, HF. Stats and facts. 1/5 of adults will develop HF. 64 million patients worldwide. $200,000 cost per QALY. 75% will die within 5 years, 25% within 1 year. 1.25 million hospitalizations each year. 18% 30-day readmission rate. $70 billion direct medical cost by 2030.
So, heart failure is a chronic condition. Cardiac disease is one of the leading causes of death in the world, and all of it leads to heart failure. So 1 in 5 people in this very same virtual room will develop heart failure over the lifespan. Right now, there's 64 million patients diagnosed with it worldwide. 25% of those will die within 1 year, and 75 within 5 years after diagnosis. It is the leading cause of hospitalizations in patients over 65, with 1.25 million per year. The 30-day readmission rate in the US healthcare system is one of the highest at 18%. And by 2030, almost 10 million Americans will be diagnosed with it, with direct medical costs exploding to $70 billion a year.
Our solution, left atrium unloading device. LAUD is a superior solution. 1. Induction charging instead of cables protruding through the skin. On a diagram showing the heart and lungs, the number 1 is pointing to 2 circles with cables attached to them placed at the person's shoulder to the right of the heart.
So Cardiost is busy developing a solution called the left atrium unloading device, or LUD. It is superior to all of others because 1, it uses induction charging instead of cables protruding through the skin, diminishing the chances of infection. 2, it is implanted using a thoracotomy instead of an open heart surgery, reducing the length of stay of the patient.
And number 2 labels a hand with a scalpel cutting a marquise-shaped incision to the right of the heart near the armpit.
3, the centrifugal pump design drains blood from the left atrium into the aorta, partially bypassing a sick and weakened left ventricle, which remains fully functional for safety purposes.
The number 3 labels a circular device below the heart attached to the aorta. It has a tube that connects up to the left atrium of the heart. Text, competitive analysis, performance. Durable MCS devices on the market are under investigation. A table compares MCS devices, LOD, PulseVod, HeartMath 3, LVAD, Corvion, Modal Heart. For the induction charging column, LOD and Corvion have check marks and the others have red X's. For the several HFRX column, LOD and HeartMath 3 have check marks. For readmissions and mortality lower, they all have a check mark. For less invasive surgery, LOD and PulseVod have a check mark.
So the number 1 differentiator of the LOD against other devices is this: we are the only one proposing induction charging mechanism, not touching the left ventricle, and treating both types of heart failure, which is very important. That is reduced ejection fraction and preserved ejection fraction, also known as systolic heart failure or diastolic heart failure.
Text, LAUD's value proposition. A photo shows the Fongs playing with their grandchildren on the beach. Text, for Mr. Fong, a quality of life device instead of an end of life one. For Mr. Fong's cardiologist, less invasive surgery with superior prognosis. Estimated length of stay, loss, decreased 50%.
The LOD's value proposition is resting on 4 pillars. The first one is the patient, Mr. Fong, for whom the LOD is a quality of life device instead of an end of life one. For Mr. Fong's cardiologist, The law means treating more of his late-stage heart failure patients less invasively and more effectively.
LAUD's value proposition, Mr. Fong's Insurance. A smiling Mr. Fong shakes hands with another man. Text, for Mr. Fong's Insurance, reduced costs, estimated QALY reduction of 25%. For Mr. Fong's Hospital, better care becomes standard of care. Estimated 20% reduction on 30-day readmissions.
For Mr. Fong's insurance provider, it's all about cost reduction when treating late-stage heart failure patients. For Mr. Fong's Hospital, it's all about better care becoming the standard of care.
Text, the opportunity market. Estimated LAUD price, $75,000 per unit. 6.7 million people in the US suffer from HF. The NYHA functional classification system places them in one of 4 categories according to severity of symptoms. TAM equals $44 billion. 580K HF patients are classified as NYHA Class 3B and 4. SAM equals $9 billion. 120K NYHA Class 3B and 4 patients with ejection fraction, EF, less than 25% each year. SOM equals $4.5 billion. 60K HF patients eligible for LAUD therapy each year. Gap in treatment, 3,500 LVAD implants per year, about 6 to 8% of LVAD appropriate patients.
The investment opportunity here is huge, with almost 6.7 million people in the US suffering from heart failure or diagnosed with heart failure. 580,000 of them are in the last 2 stages of this condition. That is a total addressable market of 44 billion. 120,000 of them have a very low ejection fraction, which means a very poor quality of life, high lung congestion, and low cardiac output. A serviceable addressable market of 9 billion. 60,000 are actually eligible for LAUD therapy, which is a market worth $4.5 billion. And guess what? Only 3,500 are implanted right now with a heart assist pump or mechanical circulatory support device. Just a fraction, 6 to 8% of the entire market.
Text IP plus collaborations. IP 100% owned by Cardiost. Patent portfolio. 1 granted, 3 provisional filed, 1 of them PCT, additional IP in the works. Collaborations. Logos 2023 finalist NIA Startup Challenge. University of Denver Daniel Felix Ritchie School of Engineering and Computer Science. Colorado Office of Economic Development and International Trade. Universidad de los Andes. CSI Life Sciences. Dorsey, always ahead.
So Cardiost is actively building an intellectual property portfolio to surrounding area of interest we would like to operate in, with the collaboration of grant funding institutions like the NIA, universities, and commercialization partners, as well as regulatory consultants.
Text, the ask, $5 million for building 25 alpha prototypes and testing them on 12 pigs. A bar graph shows funding, costs, and balance for 2021 through 2023, with $50,000 shown for Series B round and $12,500 costs.
Right now, we are preparing an NIH SBIR Phase 1 grant application for the January cycle submission. And we will be looking in the second semester of 24 or early 2025 for a $5 million investment to build 25 alpha prototypes and tested them on 12 pigs.
Text, exit strategy. Complete pilot studies and be acquired. A chart titled Recent Comps, showing 5 companies, who they were acquired by, the price tag, date, and device category, the top one being Circulite, acquired by Heartware Medtronic, the price tag, $350 million in 2013 and $1.1 billion in 2016, and the durable MCS device category.
Our exit strategy is actually to be acquired, to strategically position ourselves to be acquired by one of the leading companies in the space, like Abbott, Johnson & Johnson, Medtronic, and Edwards. They've been very busy acquiring both small and large companies in the space.
Text, our team. Cole cardiac surgeons and cardiologists, engineers, and academic institutions. A photo of each team member. Text, Nicolas Anzellini, M.B.A., CEO. Dr. Fernando J. Anzellini, M.D., CMO, cardiologist. Dr. Daniel J. Goldstein, M.D., Dr. Victor M. Caicedo, M.D., Dr. Daniel Berghoff, M.D., Ph.D., and the last person's name is covered by the speaker's video.
We have assembled a team of key opinion leaders in the field, including cardiac surgeons, cardiologists, as well as engineers, regulatory consultants, and universities to achieve our goal.
A photo of Mr. and Mrs. Fong dancing with a young girl. Text, thank you. Mr. Fong has been successfully lauded. Let's talk. Logo, Cardiost, left atrium unloading device. Nick Anzellini, CEO, Nico at Cardiost.com, 303-359-8264.
we envision a future in which heart failure patients like Mr. Funk are able to dance to the tunes of Baby Shark with their grandchildren and wife, or enjoy a glass of wine in a hot tub after a hard day of work. Thank you very much for your time, and I really appreciate uh, the NIA's commitment to our success. Thank you.